Welcome to the Baptist Health Talk Doc to Doc podcast, a conversation for physicians by physicians, providing insight on the latest in medical practice, research, technology, and innovation in healthcare. Join Baptist Health experts as they offer practical advice for clinicians covering a wide range of specialties. Cancer, neuroscience, orthopedics, and cardiovascular care are just some of the timely discussions you'll find right here on the Doc to Doc podcast.
Hello, I'm Adrian Christian, Chief of Cancer Rehabilitation at the Miami Cancer Institute.
And I'm Romer Arata, Cancer Rehabilitation Physician at Miami Cancer Institute.
Today on the Doc to Doc podcast, we'll be discussing cancer rehabilitation. And I wanted to start by first asking you, Romer, if it's okay if I call you Romer, and you can call me Adrian throughout the conversation. Romer, can you share with us what is your thoughts on the role of cancer rehabilitation in the care of the cancer patient, the cancer survivor?
Well, cancer rehabilitation really is a medical care that should be well integrated throughout the oncology care continuum, Adrian, and it should be delivered by trained rehabilitation professionals like physical medicine rehabilitation specialists, as well as therapists that are trained in cancer rehab to really address, the diagnosis and treatment of any physical, even psychological and cognitive impairments in an effort really to maintain and restore function and also improve quality of life in this medically complex population that we serve.
You know, I would agree with you 100%. And I think a key concept in this is to imagine that the care of the cancer patient starts from time of diagnosis and going all the way through the active treatment into survivorship. And even at the end stages of the cancer journey, cancer rehabilitation can play a very significant role in improving the physical function and the quality of life of cancer patients of all ages and all different types of cancers. I wanted to ask you, what do you think are the physical challenges faced by our cancer patients? And since breast cancer seems to be the most common that we typically see in our practice, maybe focusing on that population to start with.
Yeah, for the breast cancer patient population, it is well known that physical and even psychological side effects of not just the cancer itself, but also the treatments can significantly impact function and quality of life. Research and data have shown that more than 2/3 of breast cancer survivors can experience one or more long-term side effects associated from their treatment. With breast cancer, I mean, certainly there's so many things that we have to take into account because of the treatment that the patient are undergoing through. Things, for example, like the shoulder range of motion, neuropathy, and lymphedema. That's something that we have to make sure that the patients are doing well during active treatment and even throughout survivorship.
Yeah, I would agree with you. And I think it's so important to prepare the patient about the types of physical impairments that they might be experiencing. And ideally, from the time of diagnosis, we have a window until their cancer treatments start of maybe a few weeks, maybe a little bit longer. And during that time, there's an opportune time to really educate the patient about the possibility of shoulder problems or possibility of swelling of the arm, and preparing that individual for the treatment that's about to start, and then continuing that education during their actual active treatments. For example, seeing the surgical patient very soon after their surgery to really jump on any kind of shoulder problems that might be apparent if the person's not moving the arm very much after surgery, to really minimize the risk of significant functional loss of that arm afterwards. And then also to, as they're undergoing chemotherapy treatments, for instance, as you mentioned, like neuropathy and other problems, to really to educate the patients and to try strategies to minimize loss of function in the hands and feet, for example, if the balance has been affected by this. So I would definitely agree with you about that. I wanted to ask you in that same patient, the breast cancer patient, the type of physical impairments and challenges they might face in the later stages, let's say more advanced breast cancer with spread or metastasis to bone and so forth. What are your thoughts on the type of impairments that these patients face and what we can do about them?
Yeah, absolutely. Some of the patients that, especially for advanced stages metastatic disease, things that we have to, keep in mind are, potentially fatigue because of all the treatments that the patients have already gotten, either from surgery, from radiation, chemotherapy, and likely will probably be on hormonal therapy. One of the things that we have to make sure that the patient's energy level, their exercise tolerance is not as affected as much, but certainly almost always 100% of patients in the late stages will often experience fatigue. One of the things that we also have to take into account is also pain, especially for breast cancer patients that have, for example, metastasized to the spine. So it is important that in terms of getting the patients to feel better and that quality of life is not affected as much, that's something that we have to make sure that we can help the patient in guiding them the safest way to go about their daily activities, and whether or not they would need proper guidance in terms of physical therapy to make sure that they can recuperate from from the cancer itself and also the treatment that they've undergone.
Yes, totally agree with you on that. And I wanted to talk a little bit about something that's very common that we see in breast cancer patients of all stages, really, is the presence of what we call lymphedema, or typically which presents such as swelling of the arm, or a patient may report a heaviness of the arm or difficulty wearing the long sleeve shirt on the ipsilateral side. And wanted just to talk with you a little bit about the risk factors for the lymphedema and what you have seen in your experience with this type of problem.
Absolutely. So lymphedema it's very well not it's common for patients that have undergone surgery and or radiation. Depending on the type of surgery, Adrian, I mean, there's so many studies out there, but for most of the data that we look at are the prospective studies. So patients that are undergoing breast cancer surgery that may include some lymph node dissection alone, the risk of lymphedema in the affected side or extremity is typically pretty low, 0 to 7%. However, if the surgery is a little bit more involved and surgical breast oncologists would decide to take out a lot more lymph nodes, let's say 10 lymph nodes, now that risk would go up to about 15 to 20%. If the patient is going to get radiation on top of the surgery, then the risk of developing lymphedema can potentially increase to the point of about 25 to 40%. And that's just from the treatment itself. We have to take into account body habitus. If the patients are obese, certainly that's an independent risk factor for developing lymphedema. Any infection afterwards, after surgery and or radiation, can potentially bring about swelling of the extremity. So that's something that I always educate my patient to make sure that they're always taking care of their extremities. But continue to use that extremity. That's the key word that I tell them, because after surgery and or radiation, they often limit moving that extremity. So that can also be a potential risk factor for not moving for lymphedema, not moving their extremity.
I definitely would agree with you on that. And I think it's so important to educate the patient about this condition so that they're aware that it might occur. And early identification is key. This is something that typically we manage. Unfortunately, there's no cure for this at this time, but the management piece is so important. And like you said, I think weight loss is an important thing to counsel the patient about. Also to notice the signs and symptoms of skin infection, which can also be present and increase risk in the future of developing lymphedema, flare-ups, and the importance of exercising the arm. These are all things that we can counsel the patient about in our sessions, and often do. I want to move slightly to a different topic, and that's to kind of talk about the approach to the assessment of the cancer patient. Like, how do we go about evaluating the patient? What is the information that we typically collect from our patient at that first visit in helping us establish the treatment plan? And can you share some thoughts on that with us?
Of course, as a cancer rehab specialist, I mean, really the focus is on the evaluation and treatment of the functional loss and pain disorders in these patients. So absolutely, we need to do a comprehensive functional assessment in these patients. We need to look at the cancer history. What is the initial diagnosis? What were the completed treatments? What are the ongoing treatments in this patient? So it is important that if the patients are still getting chemotherapy or immunotherapy, that's something that we have to take into account. The treatment for their cancer, whether or not they've had surgery in the past or about to get surgery in the future, did they get radiation in the past, or are they getting radiation? And I mentioned about systemic therapy, which includes chemotherapy or immunotherapy. So it is really important, and that's just from the cancer history itself. So it is really important to really know the current disease status of the patient. Is there progression of disease? How many treatment plans have the patient undergone, or how many rounds of chemotherapy have they undergone through? And what were the side effects or any serious side effects that landed them in the hospital if there were like any major complications? Of course, it is also important to look at the pre-existing comorbidities in these patients. The polypharmacy. Patients oftentimes are taking other medications besides cancer, chemotherapy or immunotherapy. What are their lifestyle factors? So that is the functional assessment. And then certainly you look at the comprehensive medication review, which is really important in evaluating for any drug-related side effects that can potentially impair patients. And then we can also look at the drug interactions that can potentially be triggering some of the side effects or symptoms that they're going through. And then I would also look at reviewing any need for specific testing for patients that I see. Do they need imaging? Do they need any type of special workup like nerve conduction study or MG? Do they need any lab work? From that, then I would determine to see if a patient needs appropriate referrals, whether or not it's through our palliative medicine colleagues for medical management, or our surgical colleagues like neurosurgery, to try to see if the patient's symptoms could be potentially be treated through a surgical approach. And of course, through the treatment plan, whether it's for medication, any bracing or orthotic needs that the patient may need, any injections that the patient can potentially benefit from, and then of course, prescription for physical therapy, occupational therapy, or speech therapy, and guiding the patients throughout their therapy programs. And of course, including exercise prescriptions that they can potentially benefit from. But really the goal is to restore maximal function, and it requires a multidisciplinary team, not just what we do in our clinic, but also the ongoing communication with our therapist and also with our primary oncology teams.
I totally agree with you on that. And I wanted to add two aspects to this that I think are very important. One is assessment of that functional status of the patient at that time of that initial visit, and then also a subsequent visit. So besides doing a comprehensive neuromusculoskeletal examination, incorporating some functional exams in that visit does not add too much time to the visit, but can provide a lot of information about the person's true functional loss and reserves. So, for example, we use the time up and go test, a sit to stand in 30 seconds test, a grip strength test, and a balance test. And in addition to that, we also collect some information that the patient self-reports about their physical function as well as their level of fatigue. So I think this additional information rounds out that picture of what is a true functional status of the individual that we're seeing in front of us. And that information can then be used at subsequent visits to see, has there been an improvement, a decline in their physical function. The other part that I wanted to just emphasize to what you said was about the importance of this team approach to the patient's care. As you mentioned, there's several members that are part of this team, and certainly I think rehabilitation is definitely a team sport, and we have to not only be in contact with the oncology teams, but also with various types of therapists. So in this case, with breast cancer, we talked about physical therapists, but occupational therapists are also very important. And in other types of cancers, for example, like head and neck cancer patients, we very often have to involve speech therapists as well. Nutrition is very important component of our patients' care. As you mentioned before, the body habitus, and it's not unusual for us to see people come to cancer being overweight or obese and have various challenges nutritionally, as well as sarcopenia or muscle loss from if they've been undergoing treatments for quite a while, or maybe they come into their cancer diagnosis sort of malnourished to begin with. So these nutritional challenges require us to really think about that nutritional rehabilitation, incorporating the nutritionist as part of that team. We have the luxury of having, where we work at the Miami Cancer Institute, a truly wonderful program where we have massage therapists and an acupuncturist as well. And that also is found to be very beneficial for our patients for a variety of reasons and different types of cancer-related physical impairments. I wanted to just kind of talk a little bit about now the importance of exercise. You mentioned exercise before and that exercise prescription, and certainly we know there's information about the importance of being physically active for our cancer patients. And I was wondering if you could share with us a little bit about your approach in that exercise prescription for the cancer patients, your considerations about precautions that you'd want therapists and exercise specialists to be aware of in this. And can you share some thoughts on that with us?
Yes, absolutely. So exercise is really very important, not just in the general population, but most specifically for our cancer patients. Before going into the exercise prescription, I always talk to my patients regarding their cancer diagnosis. Are they a survivor? Are they on active treatment, or is there any progression disease? Because it's very important to consider the safety aspect of developing an exercise program. So we can only imagine some of the changes that happens to the body that with cancer patients that are undergoing cancer treatments or have undergone cancer treatments in the past. I mean, a lot of systemic changes could potentially happen through cardiovascular because of a result of chemotherapy or even radiation in the past, and even hormonal therapy that the patients are on. Some GI changes, certainly metabolic changes that happens throughout cancer treatments. And obviously the musculoskeletal as well as neurological changes that happens during cancer diagnosis and throughout treatment. But in terms of going into the prescription, there's a roundtable that happened 4 years ago with American College of Sports Medicine in conjunction with cancer societies that really looked at the importance of exercise with the prevention of cancer, as well as the survival. And ongoing studies are happening now that are looking at the benefits of exercise. So the current guidelines that's out there is really, do as much as you can, keep moving. There are specific recommendations, and it really depends on the symptoms that the patient is experiencing. For example, there is a specific recommendation now. We talked about fatigue earlier, that for cancer-related fatigue, it is important to incorporate both aerobic and resistance exercise program into their routine, because that's been shown to really help, and this is a strong evidence, and that's been shown to really help their symptoms. So, for example, aerobic activity, it's been recommended to do this about 3 times a week for at least 30 minutes per session of moderate intensity. And I tell my patients what's moderate activity in terms of the pace. So I tell them, it's enough for you to, so it's like brisk walking, enough to break a sweat, raise your heart rate, but you're still able to hold on a conversation. If you're able to do that, in addition to resistance exercise, twice a week, about 2 sets of 12 to 15 reps for major muscle groups at moderate intensity. If you combine those, that's been very helpful in managing cancer-related fatigue, whether the patients are undergoing treatment and even throughout survivorship. And of course, there are other recommendations for specific symptoms that the patients may experience during cancer treatment. For example, physical function, anxiety, depression, or even lymphedema. So there are guidelines now, but certainly more research is still ongoing to try to really come up with the best prescription plan for all symptoms that the patient may experience.
I totally agree with you on that. And it is so important to tailor that exercise prescription, as you mentioned. I think one of the challenges that we face is that there are certain populations that we don't know enough about what is the safe exercise prescription, duration, intensity, frequency, things like that. For example, in palliative care or in the end stages of life, where there can still be benefits from exercise and being more physically active for a variety of reasons. And we just don't know enough about what is a good, safe exercise program. That's why it's important to tailor it to that specific individual, see what they can do comfortably, and see how you could improve their functional status through that exercise prescription. I wanted to just focus a little bit now on work and return to work. And as you know, a lot of our cancer patients are still in their active working years, and they can work in a variety of different industries that require either cognitive abilities to be intact or physical abilities to be intact, or a combination of the two. And I wanted just to ask you, as far as return to work and your thoughts as to cancer-related physical impairments and the ability to work. What are your thoughts on that?
Yeah, my approach to patients that are either working or are planning to go back to work after their treatment, certainly, we like what we mentioned, getting a comprehensive exam to make sure that the patient is ready to work. And depending on the type of work and the environment that they're going back to, if they're going back to work. So certainly, it's a different type of consideration if the patient's going back to work and just sits on the computer and work on the computer all day, as opposed to someone that goes back to work, for example, a factory, and that requires a lot of physical labor. So in that aspect, I always make sure that, if the patient has had surgery, that, from the surgical standpoint, they are safe to go back to work. So if a patient for example, is working in a warehouse and they have to lift heavy boxes over their head. I want to make sure that, number one, they're cleared by their surgeons, that they're okay going back to work, so that to prevent any injuries. And number two, are they able to do any type of range of motion that they're required to do? So that's really my baseline assessment of the patient. So if the patients are cleared from the surgical standpoint and they can do whatever is necessary to perform at full capacity at work, then I would continue to encourage them to work on some of the stuff, whether or not they're getting physical therapy or occupational therapy, to try to get back to their work.
I totally agree with you on that. And my approach to this return to work issue starts with the patient's goals. And as far as what is your goal about return to work? What kind of work do you do? Be specific in that description. And then we match what is the impairments that we're seeing, that I'm seeing in that individual. And then when you have that and you see, okay, this is the impairment and this is the type of work that is required of them, how can we optimize that if possible for them? So for example, if shoulder limited motion in the shoulder is a huge factor for them and they work in an industry that requires them to have repetitive overhead movements, then a combination of physical therapy program, perhaps some medication to manage pain, combination of different approaches would be called upon in that treatment plan, with the patient's goal of return to that kind of work. And if they can return to that kind of work, is there another type of work that they can successfully return to? Because as we know, people that don't work often may not have adequate health insurance, which can affect their healthcare overall and their cancer treatments even. So it is so vitally important to find ways to keep the person working, if it's possible, in a safe manner for them. What I want to just briefly touch upon at this point was this concept that we haven't really talked too much about, but I think is particularly relevant and important, and this concept of pre-rehabilitation. And maybe you could share with us a little bit about your thoughts on this. What is it, and how does it benefit the patient?
Yeah, pre-rehabilitation or pre-rehab, it's something that hopefully happens prior to the patients getting any treatment. It is, basically what it entails is that, if we can intervene early on in anticipation of any potential impairment, then absolutely, we can try to help the patient. Or if the patient had prior injuries, for example, the shoulder, right shoulder to be specific, and the patient's about to undergo right breast surgery. So it is important to assess the patient to see if there's any premorbid limitation in the range of motion, if they had prior injuries or even surgeries in the past that limited their function. Because with the treatment, whether or not the patient, with the surgery and whether or not the patient will undergo radiation afterwards, can potentially bring back some of the impairments from the past and can potentially cause disability in patients. So, I'm a big proponent of pre-rehabilitation, and really the idea is to make sure that we can mitigate functional loss and prevent any impairment that can lead to disability.
Yes, I would totally concur with that. And I think we're just about out of time. And but I did want to thank you so much for this conversation. I found it very, very interesting, and I hope that our audience has as well. And the take-home message I want to leave everybody with is how vitally important it is to have cancer rehabilitation as part of that cancer journey for the patient, starting with the beginning, from time of cancer diagnosis all the way through to survivorship and to the end stages of cancer journey. So I want to thank you so much, Aroma, for taking the time to spend with us today, and please just keep in mind that cancer rehab is of vital importance to all of our patients. Thanks again.
Thank you.
To find out more about the topics covered on the Doc to Doc podcast, please visit physicianresources.baptisthealth.net.